This is News 8 This Morning.
Good morning to all of you at home here. It is 6 a.m. on a Tuesday. Good morning to you, ladies. I miss all of you so much. We love telling these stories about volunteers coming together, keeping their distance, and helping our frontline workers, our healthcare workers. They are our heroes right now. That is for sure. As we look at our forecast on this Tuesday, Heather, nice dry start, and we're really expecting quite a warm up here. Did you say something about the 80s?
Well, not quite. Not there yet, but we will be in the 70s today, so I can deliver that for you. For 60s at the beaches and into the 70s for most of our Inland Valley communities. Just wanted to give a quick shout out, though, to the Rock Church. I interviewed Pastor Miles McPherson last week, and he said their medical ministry was going to be working on the masks. And I kid you not, 4 days later, there they are. They got a group of people practicing social distance while repairing medical masks for our medical professionals. I mean, that's how fast things are happening these days. It's just truly remarkable. So thanks to the volunteers from the Rock Church for getting that done. 71 degrees at the beaches, 77 inland, 71 in the mountains today, low 80s in the desert. Maybe that's what Eric was looking at a little earlier. As far as the rest of the county goes, get ready for cooler temperatures to move back in tomorrow. We have some clouds in effect today, and then a mix of sun and clouds for you by Wednesday. That's a look at the forecast. Let's get it over to Jenny. Good morning.
Good morning. It's Tuesday, by the way, if you're keeping track. You know, it is actually busy traffic-wise. I've got a lot of crashes out there. First of all, northbound side of the 5, right at Coaster Station, there is a crash there blocking a lane. If you're going to be traveling southbound side of the 5, right at the 78, so Vista Way, there's a crash blocking one lane. Southbound side of the 5 at Encinitas, same story. Crews are on the scene. They're working on a crash. There are no injuries reported there. Southbound side of the 5 at Las Pulgas, they just, my CHP page just changed, so they just cleared that away, so all your lanes are back open. Freeway times are fine. Back to you.
All right, ladies, we will check back in with you here shortly. The number of coronavirus cases in the county is now up to 603, which is a 84-case jump since yesterday. The update includes 118 hospitalizations with 51 people in intensive care. The outbreak continues to accelerate across the globe, now reaching over 800,000 cases this morning worldwide. Yesterday was the highest single-day total number of deaths reported in the U.S., with more than 500 in a single day across the country. Stella?
Eric, thank you. In San Diego, grocery store workers are very busy these days. We know that. Many stores are offering increased pay and safety measures. But today, some workers are planning a walkout. News 8's Netta Rampur joins us live from Whole Foods to explain what is going on. Good morning to you, Netta.
Good morning. Yeah, we're talking about a walkout on the national level. They're calling it a global sick out that's expected to take place at various Whole Foods markets. But I got to tell you, we're not sure if the San Diego markets will be impacted. In fact, a couple people I spoke with in this parking lot, some employees of this Whole Foods, say they do not plan on walking out. In fact, one man just said they treat them very well here, so they're going to stay put and keep working. But we'll keep an eye on things and let you know if it will impact Whole Foods markets across our area. So as far as the Whole Foods employees, what they are requesting is paid leave for workers who self-isolate during this outbreak. Right now, Whole Foods does offer employees paid sick leave if they test positive for COVID-19, but not if they are voluntarily self-isolating, and that's what they do request. So this global sick out was originally scheduled for May 1st. It was moved up to today because of the increased demand for groceries. This all comes a day after workers for Instacart and Amazon walked out. Instacart shoppers did not go to work yesterday, so you may have noticed that on the app. In a statement, Instacart says they're immensely grateful to their employees, and the company says it will offer bonuses, paid sick leave for those diagnosed with COVID-19, and they're working on hand sanitizer specifically for their shoppers. And on Staten Island, New York, 100 Amazon workers staged a protest outside the warehouse yesterday. At least 13 Amazon warehouses have reported COVID-19 cases, and here's the Amazon strike lead organizer.
We're very low on masks. We don't have the proper gloves. All we want is the building to be closed and professionally sanitized.
The recommendation is that employers protect their employees as best they can if they're required to go to work or if they're going to work.
And of course, as we know, grocery store workers are considered essential workers. That employment law attorney did say at this point, workers and stores do need to really come together to negotiate the best terms because, of course, none of these places have gone through this before. Whole Foods does say, again, their team members can get 2 weeks of paid time off if they test positive. They also get an additional $2 per hour on top of hourly base pay and increased overtime pay. We did get a statement from Whole Foods, and they say in part, as we address unprecedented demand and fulfill a critical need in our communities, Whole Foods is committed to prioritizing our team members' well-being while recognizing their extraordinary dedication. They say they've taken extensive measures to keep people safe, social distancing, enhanced deep cleaning, and crowd control measures, and they continue to roll out new safety protocols. And here at this store in the UTC area, they will be opening at 7 a.m. for senior citizens. That's their hour to go in first before they then open to the rest of the public. And they are, of course, requesting the public to keep that social distance when you're shopping and also keep a distance from the people who do work here. And that's the very latest here. We'll send it back to you.
All right, Netta, thank you. Let's get to the 3 things you need to know today about the coronavirus. Number 1, a San Diego State student has tested positive for COVID-19. The university tells us that the student started to feel symptoms after moving off campus. Everyone who had contact with the student has been notified and is receiving appropriate guidance. No other information about that student has been released. Number 2, starting tomorrow, cruise ships here in San Diego will be banned from offloading passengers and crew. San Diego has seen 5 different cruise ships disembark thousands of passengers, with the latest being the Celebrity Eclipse that docked yesterday. They will be the last scheduled ship to dock in San Diego that will allow passengers and crew to get off for the time being. Upon leaving the ship, they all received health screenings first. Health officials said none of them showed symptoms of coronavirus. And number 3, the Food and Drug Administration has now cleared doctors to treat COVID-19 patients with a pair of anti-malaria medications. We've been telling you about this. Doctors say hydroxychloroquine and chloroquine may help some victims clear the coronavirus from their bodies, but the drugs have yet to be rigorously tested. So the FDA says the risk, though, is outweighed by the possible reward. Millions of doses of the medication will now be distributed to hospitals around the country. And the USNS Mercy is now treating some of its first patients as it remains docked at the port of San Pedro in Los Angeles. The Mercy has 1,000 hospital beds and nearly 900 staff on board to help alleviate Los Angeles area hospitals. This is one of the many initiatives being put forth to help an expected surge of coronavirus patients in the coming weeks. As the number of California cases just continues to increase, Governor Gavin Newsom is calling for reinforcements to help surge the state's healthcare workforce. News 8's Chris Groh is here to break down Governor Gavin Newsom's announcement, and Chris is also going to be giving another update here today.
Yeah, Eric, he'll be starting to give his daily updates here at noon, and we do expect another type of announcement, if you will, about how they plan to help out seniors staying at home. But back to this new surge in healthcare workers, the governor pretty much estimates that there might be anywhere from 37,000 potential healthcare workers that could be reinforcements should things get really bad. And those include the recently retired nurses and doctors, as well as medical students close to graduation. Now, those that are close to completing their studies, as well as those recently retired doctors or nurses, can go to the state's website to go ahead and sign up, and then they'll be called if and when needed. Now, the initiative will loosen the rules on those students to allow them to begin practicing, but under the supervision of medical professionals. While the state estimates that those 37,000 are eligible, that need would vary by city and demand. So it's not necessarily that we're going to see 37,000 medical workers just jump right in. Those are how many are available, and then the need would be dispersed as it sees fit. Now, hospitals in San Diego, like Palomar Medical Center, for instance, are managing the influx of coronavirus patients and their regular casework. So they don't need additional doctors and nurses, not yet. But that could change, and they would welcome help from new graduates should things get worse. Governor Newsom added yesterday that additional measures will be taken to combat the virus like this one moving forward.
The next few weeks are going to be critical in the state of California. In the next few weeks, we're going to do more to flex and to surge and do more together to meet this moment.
And today's announcement will be happening at noon today. We're told that it has something to do with to help keep seniors connected while they stay home and away from others to try to reduce their exposure to the coronavirus. Back to you.
Chris Grow live for us. Thanks, Chris. A California scientist and his team claim they have found a potential cure for COVID-19. We introduced you to Dr. Jacob Glanville of Distributed Bio a couple of weeks ago. He's one of the doctors featured in the Netflix documentary Pandemic. His team has been working around the clock trying to come up with a drug to treat COVID-19. Yesterday, he announced he believes they've found one.
We are happy to announce that we have completed the engineering and we have some very potent antibodies that can be effective against the virus. We are sending them out to the
Boy, you love to hear that. He says his team took antibodies used to neutralize SARS and used technology in their laboratories to adapt them to recognize COVID-19. Dr. Glanville projects human trials in the United States could begin this summer, and if all goes well, a drug could be ready by this fall. So incredible breakthroughs continuing to happen here, and we really need those advancements right now, that's for sure.